Have you seen a change in the sort of type of brain injury patients that you're seeing, or the number or anything like that?
Yeah, we see a lot more, there's a lot more diversity within the socio-demographic of the head injury. I would say it used to very much be, even in the last 7 years, it used to be very much young 20 to 30 men in that classic age group, a lot more trauma, hypoxic brain injuries didn't used to survive as well as they do now. So we're seeing a much broader range of hypoxic injuries on top of the traumatic brain injuries. So people are surviving out of hospital cardiac arrests a lot more than they used to. So we're seeing a lot more of them through. People are surviving drug overdoses and suicide attempts a lot more than they used to. And that's mainly due to defibs in the community, better awareness of CPR and life support mechanisms within the community, better access to paramedic crews, and then obviously the heli ambulance, getting them to a specialised centre in an appropriate timescale. I think we do see this, that same socio-demographic of head injuries, but they certainly don't form as large a proportion of the patients that we treat as they used to. And then a lot of them are surviving much more severe injuries because of the willingness to use craniectomies more quickly to reduce the pressure.
So, have you seen changes in terms of age and gender, or ethnic groups or anything like that?
I wouldn't. Yeah, I mean, again, I think with the diversity of the age group and the nature of the injury, you increase the diversity of the age group and the ethnic group. We see a lot kind of more middle-aged older people that have had out-of-hospital cardiac arrests, and we see more young females that have had out-of-hospital arrests and drug overdoses that have survived, who probably wouldn't have survived 10 years ago.
Wow.
Yeah, and then older people who have fallen, we see more of them because they're in better health generally, so their comorbidities don't affect their mortality before they get to hospital. So your subdurals, their comorbidities then affect how they are post-injury, but their comorbidities are better controlled, better managed, so they don't affect them before they get to hospital quite as much as they used to.
Yeah,
I would imagine. The other group of people I would say we've seen a massive increase in is late middle-aged people who fall downstairs.
Oh wow.
Yeah, after alcohol-induced incidences, who again may well not have survived the incidents, but I think alcohol-related disorders in that generation are increasing massively